Before I started experiencing the pain, I was very active. I pretty much worked 2 jobs my entire life. I taught school and I did a lot of woodworking. My father was a home builder, and so I didn't have summers off. I built houses. After I retired from teaching, which now was about almost 20 years ago, I continued the woodworking aspect of it. And so I've been very, very busy. I've never had to put limitations on what I did or what I do. And all of a sudden in December, that pain hit me and I was done doing just about anything. It didn't subside. It just was awful. And I thought, what in the world has happened?
So as I sit there in the exam room and I listen to patients like Mr. Pabst, what I'm trying to do is to filter through and understand what the source of the pain is and then how it affects them. On his x-rays, there was clear evidence of spondylolisthesis, which is, in layman's terms, a slipped vertebrae. If you look at this model, these are discs and there are bones above and below the disc. The disc is what glues the bone together. The disc is a lot like tires on cars. The more you use them, the more the threads wear out. So as the threads on the disc wear out, they shrink and they put pressure on the nerves, and they can also lead to instability where the vertebrae are no longer glued to each other but start shifting relative to each other. In the context of that, it made sense that he was experiencing back pain from the vertebrae shifting and then pain traveling down the leg from the nerves that were being pinched.
With patients who are receiving minimally invasive procedures, we're seeing shorter hospital stays, early mobilization, and overall requiring less narcotics in the post-op period, just returning to normal activity much quicker compared to the traditional posterior instrumented lumbar fusion.
It is a privilege to work within the Parkview Health system because not all health systems are as favorable to allowing the development of new technology and then promoting it. Everyone from the OR staff to the management has encouraged that we adapt and bring the new technologies to Parkview, and we've been able to be on the cutting edge of spine because of their support.
I was very impressed with Dr. Gore. He was right to the point. I had no qualms whatsoever. I really felt good. I felt confident in him. Everybody treated me really well, and they were very, very informative about what was going to take place, and they were very, very pleasant about it. I have improved so much since the beginning of my recovery. Each day is almost like a better day. I'm getting back into my shop. I'm doing a lot of things I wasn't able to do.
He had a wonderful post-op outcome. He's progressing as expected, if not maybe a little bit above the curve. It's just been a pleasure to work with him as a patient. He's been the perfect patient, has done everything, that he could do to help his recovery, everything we've asked and more, and it's just been a real joy to take care of.